It's another day with the physicians where your health is our business. Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know is
You're welcome back to the training culture of your regular program.
Cholera is the disease that is caused by parasites and is very prevalent in our community here.
In some developing countries, traditional bone setters are popular and can be the only address for treatment of bone-related injuries. Most often, it will be the case that there is a shortage of orthopedic doctors and surgeons in the country, and so the two practitioners coexist in the same setting. In parts of South Africa, South America, Asia, and Africa, traditional bone setters treat musculoskeletal injuries in general, not just fractures and dislocations. Traditional bone setters are also known to offer cheaper services and allegedly faster treatment options. Why do they try so much? Why do traditional bone setters try so much, even in modern day setting? Traditional bone setters and the modern practice of medicine will be the topic of today's discussion on your regular TV health talk show, The Physicians. Just stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agberie, and it's always a delight knowing that you are always waiting anxiously on your every Saturday, weekdays, Saturdays, Wednesday, to hear from us, the physicians, because your health is our business. Today we'll be discussing traditional bone setters and the modern practice of medicine. With me is my guest, a very, very renowned orthopedic surgeon, a very familiar face to on the physicians. He is no other person than Dr. Bolarinwa Akinola. He is an orthopedic surgeon with the Cedar Crest Hospitals here in Lagos. Doctor, you're welcome to our program.
Thank you very much, Dr. Agberie.
As usual, you're looking very good. You don't even look like an orthopedic surgeon.
Wow.
Anybody who sees you won't know that you actually do that work of bone that has to do with the bones.
I know.
Okay, so nice. We're having you again. Let's go straight to what we have for today.
Yeah.
Traditional bone setters and the modern practice of medicine. Do you want to start with the modern practice of medicine, or you want to just tell us a little bit about the traditional bone setters? A general overview before we dive into some very, very, very important parts of it.
All right. Thanks very much, Dr. Agberie, and thanks for having me again. It's always a pleasure to be here on The Physicians. As always, So I think this is an interesting topic, and it's an interesting notion as well. The first thing I'm going to say is that looking back through history, looking back through time, the concept of traditional bone setters, even though it seems like a very African thing, is actually not. Even if you go back to Europe, if you go back to North America, before those people had established practices, and that's why we call it the modern practice of medicine, before they had established practices, the traditional bone setter used to be the mainstay of orthopedic treatment, fractures, dislocations, some musculoskeletal injuries as well. Those were the people who were at the forefront of treating patients or treating people. And some of them had really, really, really good ways of doing things. They had really, really good methods. Some of them were able to study their work and see how effective they were. But over time, as medicine became more scientific, as medicine became a discipline that was studied in school, a lot of these practices began to go out of fashion. And not more out of fashion, but more inculcated into the medical practice, and also taken over by the medical practice and advanced by medical practice as well. So it's a long-standing history. I mean, there are lots of videos going around that shows how before the Europeans came to Africa, for instance, people were performing cesarean sections, people were doing neurosurgical procedures. Now, those were very crude ways of doing things, and that's the same with the traditional bone setting method as well. It's somewhat crude way of doing things, but it's effective in some ways. But however, it's a kind of a crude way of doing things, and modern medicine has moved on from there through the process of scientific inquiry, observation, hypothesis, testing your hypothesis, looking at your data, coming to conclusions, refining your methods, and coming out with a better way of doing things.
Okay, it's very, very good. Interesting knowing that they were there from the onset, just that with modern practice, they started their usefulness became, how do I want to say now? They weren't now very obvious again. But in some rural communities, they still operate, not even only in rural communities, even in modern communities. Where I know of some patients that they go to the real hospital, they tell them they need surgery, and they just say, no, I don't need surgery. Probably I will pass on if I do surgery. So they still visit the traditional bone setters. So, but then, maybe you want to tell us if there is a bone injury, so that we'll be able to understand it properly. If there is a bone, like a fracture, what are the processes? So that we'll know if the same thing occurs, if the traditional bone setter does the same thing. Because if you say they were the ones that they started the bone, we didn't have modern practice, and they still had successes at that time, was it complete compared to what we have now?
All right.
So when you tell us the real thing that happens when you have a fracture and you go to a modern hospital, how does the healing take place, and how long most times does it happen?
Sure. Thank you very much. So before I answer your question, the first thing I'll say is this: if you take if anthropologists go to an area and they come out with carcasses or skeletons of animals, you will find a number of animals that have had fractures, and the fractures have healed. There's nobody treating them. Fractures are programmed to heal. The same way, if you have a wound on your arm, the wound will naturally heal by itself. When you have a broken bone, the way the body wants to put that bone together is to heal it. So naturally, every bone is programmed to heal by itself. Most of the time, what these practitioners do is to manipulate the bone into a position that allows function to continue after the bone might have healed. Because if you think about it, if you have a break of the bone and a bone that used to face straight is now turning to one side or the other, even though the bone may heal, it may not give you the function that you used to have before. The other aspect of it is that with any fracture, there is pain at the onset. When you have a broken bone, there's immediate pain. And so how do you control that pain while the healing process is going on? That's one other area where people come into play. When you have a dislocation, the joint is out of position. If the joint is out of position, it's going to affect your function as well. how do you put this joint back into its normal position so that function is regained? So on the one hand, you may have a bone that is broken, that heals. On the other hand, you might have a healed bone that has healed in the wrong position that may not function for you as you should. Maybe you used to be a certain height, suddenly you're not at that height anymore because you've had what we call a malunion.
Okay.
Maybe you now start to limp because the thing hasn't set properly. So these are all the things that can happen with a fracture. However, what a lot of the historical traditional bone setters have learned to do, and sometimes some of them are excellent manipulators. They're very skilled at manipulating bone. And remember that they're doing it without the benefit of x-rays, either before or after. It's a feel thing. They feel it. When you have a break of a bone, you have swelling. You have what we call crepitus. Crepitus is when the bone ends are moving and you can hear them scratching on one another. You have swelling, you have pain, you have crepitus, you may have a deformity as well. Those are things that, whether I'm an orthopedic surgeon or they are traditional bone setters, just with your hands, you can detect these things. And so, because of that ability to detect things, you can now decide, okay, this is not in the best position, let me manipulate it and put it back to where it should be. And that's what they're really, really good at doing, manipulation. And just quickly before we move on to the next question is, in as much as I talk about the modern practice of medicine, I have to break it down into two.
Okay.
So on the one hand is what has happened in the West, in Europe, in North America, in some of the more developed countries. On the other hand is what is currently happening in the low-income countries, like particularly like the continent of Africa. In those settings, we have two aspects to look at this modern practice of medicine. The first part is the practice of orthopedics. Okay. As far as the practice of orthopedics is concerned, the traditional bone setters are quite at the rudimentary edge of it. Okay. They are a group of people that are being phased away. Eventually, they will be phased away. It may take another 100 years, but eventually they will be phased away because the practice of orthopedic surgery, orthopedic medicine and surgery is so advanced and has such a wealth of scientific data behind it that inevitably this will happen. However, the other side of the modern practice of medicine is the public health aspect of it. And from a public health perspective, these are the things you've touched on. They have popularity, people patronize them, they are cheaper, at least relatively cheaper, they are widely available to people without all the things that go on with the hospital sector and all of that. So people believe so much in this group, and we have a dearth of well-trained orthopedic surgeons in our country for the population we have, that for the foreseeable future, they will continue to occupy a role in society. And the question really is, how do we bring them in to be able to continue to occupy that role while minimizing some of the untoward effects that happen as a result of their being part of the health system?
Okay, so I will come back to you again, but then let's hear what our viewers have to say out there. What you have to say about the traditional bone setters. Are they still very viable? Are they still very important? In your community, have you visited them before? Did it work for you? Do you really believe that after a while, you will stop patronizing them? Don't go away, we'll be back after the short break. Stay tuned.
Traditional bone setters are those who try to reconstruct the leg. I don't know if I use that word right. So that someone who has a fracture or a broken leg will be able to walk again.
The traditional bone setter is someone that doesn't go through any formal education concerning anything that comes with bone settings.
Traditional bone setter, we can refer to them as local traditional doctors.
We patronize them basically because, number one, it costs less and they are also faster compared to modern hospital treatment. And one thing they also do is that for you to go, you go through less stress when you patronize them. That is, as in going through X-ray, some other things that will be needed in the medical hospital. But compared to them, you don't need to go through all that stress.
The reason why people patronize them is they feel they are effective and they help the leg heal faster?
Well, we can say yes, because their knowledge on medical line and human being, nature of a human being, they don't know much. All they know is to set. So if there is an error while setting, it could expand to a bigger problem for that patient. But if it is in the modern system, they can decide to say, okay, this to this level they can put it, but them they cannot put it. But at times they did their work very perfectly.
Bone setting by these people are not dangerous at all, because I've seen lots of people who got healed from going to them and them helping their legs, helping them walk again. So I've seen a lot. So it's not dangerous at all.
I don't think it is dangerous. The reason why I said it's not dangerous is that, number one, they don't need to open, they don't need to do any opening of the skin to get whatever they want to do, and you don't need to go through any stress.
Yes, the benefit is that these people are close to you. They can speak your language. You can interact with them freely, like the hospital. If you go to the hospital, the nurses maybe want to become wide. They may want to say no, this the doctor. But in that bone setters, you can go to them, talk to them in your own language, and they feel your pains.
Number one, which I said earlier, it costs less. Number two, it's stress free, and number three, no after effect.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We have been discussing a very, very important topic. I'm sure you will agree with me. That has to do with traditional bone setters and the practice of modern day medicine. And in the studio, Dr. Akinola Bolarinwa, a consultant orthopedic surgeon with the Cedar Crest Hospitals here in Lagos, been tutoring us about it. And of course, the reasons why we still have them in our community, in our society, in the world at large. But then he said something very important, that with time in the nearest future, it's very likely I will not have them available again. But why do we have traditional bone setters? One of the reasons he said is probably because we don't have enough doctors. It's understandable, the death of orthopedic surgeons, mainly doctors out of the country. And so you now have it, based on the population, you have very few people, very few of them available to serve the needs of the community. But is it still very dangerous? He said, of course it is dangerous. Even if you have an injury, if you have a bone injury, the bone will heal on its own. But then, how will the healing process be? Will it heal normally, with proper alignment, or it will not heal properly? Will this be very useful? We'll find out in the course of the program. So, Dr. Akinola, before we went on break, you said something about the death of doctors and the environment, the bone, how it will heal, and whether it will heal properly or not heal properly. And most likely it's going to be extinct in the nearest future. But then it's still very far. We still have them in our community, in our midst. So let us talk about this. Is bone setting dangerous?
All right, thank you very much for that question. I was just going to quickly clarify one thing I said earlier, which is I'm not necessarily saying that the reason why the public trust so much in traditional bone setters is just because of the death of doctors. No, because think about it. There might be so many doctors, but they also have to be orthopedically trained. Otherwise, they may also have a lack of appropriate knowledge in dealing with some of these issues properly. Sure. However, there is public trust. These people are members of the community. Sure. They have some success. Such successes are sometimes because of them, sometimes irrespective of them.
I think the success is relative.
Absolutely.
It's relative.
But is it dangerous? Yes, it can be dangerous. And one of the practices that we as orthopedic surgeons see a lot of the time is this practice of tying the body part to a splint, and they tie it so firmly that it cuts off the blood supply.
Wow.
And I've actually seen patients, especially children, who come and they have the limbs are no more functioning because these things have been tied on so tightly, too tightly in fact, and the blood supply has been cut off. Sometimes you have people who have come in with open fractures. These are fractures that have a wound communicating with the outside, and they have these concussions that they rub on the skin to help the bone healing. Okay. And some of those things we don't really know what they are made up of, but if you rub those things on things like open wounds, they can cause infection. they can lead to conditions called osteomyelitis that becomes a big problem going forward. Sometimes you have, and if you ask the average orthopedic surgeon, they will have story after story after story of patients that have been quote and unquote mismanaged by the traditional bone setters who have now come secondarily to the hospital. In fact, I remember when a few years ago when I ran a charity clinic, I remember that I asked one patient who came to see me, and I'm like, why didn't you go to one of the orthopedic hospitals? Say, oh, we only go there, they only do amputation there, they only do amputation
Seriously?
there. And the reason why people get the teaching hospitals get that bad name is because a lot of people have gone to the traditional bone setters.
I agree.
Some of those things have not been well managed. By the time they now get to the hospital, the situation of the limb is so bad that the only thing you can do is to amputate the limb. And then the hospital now gets a bad reputation. Oh, all they do is amputation, which is clearly a very difficult situation to be in. But having said that, there's always been and this is why I alluded to the public health importance of the traditional bone setters in our environment as of today, because I know that there's a running battle between orthopedic surgeons and traditional bone setters.
Same battle with traditional birth attendants and...
Absolutely, absolutely. But the question I'll ask is this: if people have a choice today, between going to a maternity ward in a hospital today or staying with a traditional birth attendant, most people will go to the hospital. If people have a choice today between having a crude cesarean section done under non-sterile conditions or going to a hospital to have it done, most people will go to a hospital. There is no debate really between the specialty of orthopedics and the practice of orthopedic medicine and surgeons and the practice of traditional bone setters. There is no debate about it. One is clearly far advanced compared to the other.
Absolutely.
We have ways of looking at the bone. We have ways of monitoring what we do. We have ways of correcting ourselves and say, oh, these things we used to do 50 years ago, they no longer work. We need to try something else. We need to gather more evidence. We need to gather more information. We need to gather more data. There is clearly no competition between the two. Even if the traditional bone setters might think because we started first, we're superior to orthopedic surgeons. Some people go to the hospital and they come back to us because they haven't done well in the hospital. All those stories abound. But from a purely objective point of view, there is no discussion. However, in the primary health setting, I believe that there can be a role for traditional bone setters. There definitely can be a role for them because we don't have enough people to look after our patients. We don't have enough people to look after these fractures. What we then need to do is to find a way to standardize their practice, to formalize what they do, to have instructional courses to help instruct them in ways they can practice safely, and then to know what needs to be referred. What should not be kept. If somebody comes with an open fracture, don't keep the open fracture, refer the open fracture. If they come in with simple, straightforward fractures and dislocations, they can be taught safe practices of how to do that. It's unimaginable to think that in this modern day, people are still applying a splint too tightly that causes limbs to stop functioning, that causes limbs to die, because there is no way of self-regulating their practice and saying, oh, this is what we did the other time, maybe we shouldn't make it too tight. How did they learn? They learned by observing their fathers, their mothers, their relations. It's a generational thing that has been passed on from one generation to another generation. There is no real proper scientific method of observing their results and adapting based on what they've done before. So this is where the problem is. So there is a role, I think there is a role for them. Some of my colleagues will not agree, but I think they have to be formally brought into the sector, have some sort of formal training, have some sort of understanding of what is beyond their limits and what is appropriate for them to do. And there should be some form of supervisory capacity to ensure that at the end of the day, the patient who we're all meant to be serving is not compromised in any way.
Thank you very much. So the role of the traditional bone setters has nothing to do. It cannot be compared to that which you will obtain from the modern day practice doctors. I think we'll rest it on that. Thank you so much, Dr. Akinola, for coming on our program. It's been a whole lot. You have actually schooled us on this. Now we know that we can't do away with the traditional bone setters, just that they need proper education, and they should know when to refer their patients. So on this note, I want to say thank you so much for being part of our program today. Till next time next week, make sure you keep a date with us. But always remember to follow us on our social media handle, on YouTube, on Instagram, on Facebook. And again, if you want to be part of this program, you're just a click away. Just send us an email and you'll be invited. My name is Dr. Martina Agbeme.
Hello everyone, a very good day to you out there. I am Dr. Tolani Oyerinde, a mental health physician, and I'm here on the program The Physicians to discuss self-health care. Make sure you get the right information to engage in self-care. So everyone out there, please keep watching The Physicians. Do not miss any episode. Your one-stop station and shop to get the right health information. Thank you.
Thank you very much. Now, the orofacial region, as we call it, for those of us in that field, is made up of the face is divided into the upper third, the middle third, and the lower third.